Okay, great. Look, my first question, I have asked this before, is has the Blood Authority looked at blood samples back to the last quarter of 2019 to determine if there were any COVID antibodies found in the blood back then? And the reason why I asked that question is that there was a study done in Italy in regards to cancer that found COVID antibodies, both IgM and IgG, in blood from as early as September the 3rd, 2019. And in the September-October period, they found 23 cases out of 162, 14.2% of patients. And, sorry, that was the October period. In the September period, October period, they found 27 out of 166, so 16.3 people sampled in that particular trial actually had COVID antibodies as far back as September in Italy. So have we got the same situation here? Is it worth looking in terms of pandemic preparation to find out whether or not there was any COVID in the community in the last quarter of 2019?
Thanks, Senator. John Carl, Chief Executive of the National Blood Authority. Just as a point of clarification, perhaps, the National Blood Authority doesn't do any testing.
Yep.
One of the things it does is manage the collections that are undertaken by the Australian Red Cross Lifeblood.
Sure.
So Lifeblood determines through the appropriate regulatory processes that are imposed by the Therapeutic Goods Administration, the testing that's required to ensure that Australia's blood supply remains safe.
Okay, then well, let me come back to you, Professor Kelly. Professor Murphy, should we look at the blood from the last quarter of 2019 to see if there was any COVID antibodies in any of the stored samples?
Lifeblood, has anyone answered, Paul?
Thanks for your question, Senator. So we are looking at antibodies to COVID-19, the virus that causes COVID-19 in blood as part of our serosurveillance studies. There were some done early in 2020 and found after that first wave that came to Australia at that time, very low rates of infection, as you would expect with the small numbers of cases we saw at that time. There have been 3 other surveys through this year which have demonstrated very high rates of antibodies right throughout all age groups and in all states. So we're using those tests to really monitor the spread of the virus throughout the community in Australia, but also to reassure us about hybrid immunity and the element that previous infection shows to that.
Okay, so in regards to early 2020, how early did you pick up those antibodies?
I believe
really
it was in
break out.
March, but I'll take that on notice. That was it might have been in May actually. Now I think about it, it was after that first wave that happened February, March. So
Sure.
It was in May.
Well, we know that. Well, you expect to see antibodies then. I guess I'm curious as to were there antibodies before it started to run in the media.
As far as I'm aware, we've not done that testing in Australia, and I would put to you, I'm not sure that would be of a great use of funding to do that.
Well, it's not hard. I mean, it's not hard to do some antibody testing. It's just would be
it's
good
not
to know
hard,
if it
but
was in the community.
it does cost money, and so I wonder what would be the benefit of doing that?
Well, I mean, these patients are asymptomatic. So the question, we spent $8 billion on vaccines, of which, we didn't use anywhere near even half of what we bought. As I said, it would give us a better understanding of how people react to antibodies, COVID antibodies. Yeah.
Yeah. No, as far as I'm aware, there's none of that testing has been done or is planned at this stage.
Okay. Next question is, and I'll stand to be corrected on this, is that basically you could donate blood up 3 days after a COVID vaccine. Is that correct?
That's correct, yes.
So are you aware that studies in the TGA non-clinical report showed that the lipids stayed in the body for up to 9 days? Spike proteins have been shown to stay in the body for up to 60 days afterwards. Wouldn't you have a much longer cooling off period after the actual receiving the COVID vaccine, given that technically the body's been trained to produce spike proteins, so wouldn't you want the spike proteins out of the blood before you started donating it?
I don't think there's any evidence that they're in the blood, Senator.
That's right.
I don't think that's been proven, but I don't know whether we've... Unfortunately, Professor Skerritt is in Ireland at the moment. I don't know whether he was going to try and join us.
He was there earlier. But
Was he? I think he's chairing a meeting.
Yeah, no,
now.
that's fine.
Yeah.
I'm just so
But
when you say
I think
this-
that these things are all looked at very carefully in terms of the regulatory environment around blood donation. But I'm not aware of any evidence that vaccine material is found in blood.
Well, in fact, there are published studies that say it's not. So there was a study published a bit earlier this year that indicated that transmission of SARS-CoV-2 has not been reported.
transmission.
Anywhere, yeah. So you might find neutralising antibodies in some of the products,
Yeah.
but there's no evidence that there's any risk of transmission-transmitted infections, either from vaccinations or from people that have contracted COVID.
So this study shows that lipids were still increasing in various body organs after 48 hours, and then the study was stopped. So given that lipids were increasing after 48 hours, and we know that there are ionic lipids, unlike what Professor Skerritt said, have you tested for lipids in the blood?
Well, a prerequisite for donating blood is that you've got to be healthy and well, and there's
Yeah.
assessment processes that are done at the donor centre to ensure or to assess whether a person is healthy and well.
Yeah.
And in addition to that, so the 3 days that you mentioned is based on the expectation that post-vaccination there's usually, if a person is unwell, that usually lasts for about 2 days. So it's the current deferral is set at 3 days post-vaccination.
There's plenty of people who've got the vaccine and been well after the vaccine. It's not like it
Yeah.
makes everyone sick.
So you've got to be healthy and well,
Yep.
and to donate blood, and there's no evidence of any transfusion-transmitted infections
So
from
is there an absence of
the
evidence or
vaccination
evidence
or
of
from
absence?
COVID.
So is there an absence of evidence or evidence of absence? So when you say there's no evidence, is that because there's been no studies done?
There have been studies done, and
So can you
there has
send
globally.
that through to me?
I can send you a link. Yeah.
Sure. Okay. Because I've got studies that show the spike protein remained in the body for up to 60 days. So I'm just a bit confused as to, different studies saying different things here. I would have thought you'd spend longer than 3 days as a matter of precaution.
Being in the body and being in the blood is different,
Sure.
Senator. Yep.
Okay. No worries. I'll take that up. And can people elect to donate blood in advance to store for later use? Their own blood?
Yeah, there are programs that for elective surgery where people can donate their blood and have it stored. Those programs have been running for some years. I don't know whether Professor Kelly is across any of the details on them, but
No, I don't have any detail, but that's right. It is possible to do that, Senator.
some people who
Is
are
that
having-
just for elective surgery, is it?
Yeah, it's for elective surgery, where it's predicted that they might need some blood, and people particularly became prevalent during the HIV outbreak, that people felt that they wanted to have their own blood, and so that they could have some blood taken prior to surgery and have it properly processed and given back to them during surgery. That provision is available.
Thank you. That's all.
Thank you, Senator Rennick.
Authorised G. Rennick, LNP Chermside.